Okay, we're going to shift topics now to problems that affect females. And in our first category would be orgasmic dysfunction. This is the most common female dysfunction, or at least the one that they complain about the most often to their caregivers. It's defined as the inability to experience orgasm. So it's kind of similar to what I was talking about in the last section with males, right? Not being able to reach orgasm. The causes: depression or anxiety, relationship problems, very similar to what men might be experiencing, right? Where it's hard to be responsive if the relationship isn't, supportive or satisfying. Depression or anxiety, same exact biological kind of psychological factors. It's a side effect. It's considered a symptom of depression to have lack of interest in sex or finding sex not satisfying anymore. Anxiety disorders, you can imagine that it's going to interfere with how the brain's working. Now, introducing separately for females, the researchers have pointed to prior sexual abuse as a source of orgasmic dysfunction. For female respondents, having had, situations where they were not in control of their own body, has a profound effect on their long-term ability to respond, even in situations where they are in control of their own body and they are in a loving and supportive relationship. So we consider that a psychological factor because a lot of times we have to work through those issues. Just like with men, poor body image can have an impact on healthy sexual functioning, where if a male or female feels like their body is not that attractive, or that their partner's not really that into that, or how they look, or they're inhibited about how they're looking, that can have a big impact on their responsiveness. Cultural or religious taboos, same thing for females that I said about males, right? If you feel like you shouldn't be doing this, you're probably not going to be as responsive. I guess there's a certain possibility that when there's cultural or religious taboos, you might actually find it more erotic to be, breaking the taboos. But when we're talking about a person who has this disorder, you would say, well, maybe they're having it because they feel guilty or something like that. Something that comes up more often with females is that they're worried about, becoming pregnant. And so that inhibits them, that they've got this other part of their mind, kicking in this anxiety about pregnancy. And then just general stress can really interfere with women's orgasmic functioning. Being unable to really let that parasympathetic nervous system take over and get them fully aroused so that then they can ultimately go into the orgasmic side of it. Biologically, there's, a lot of medical conditions that can really interfere with orgasm in women. Low estrogen can interfere with orgasm and the contractions of the uterus and things. Medications. Interestingly, for males with orgasmic dysfunction, antihistamines seem to be a treatment. For females, it might be a cause of orgasmic dysfunction. So, we can't necessarily interchangeably, on our own attempt to use things that might work. You want to make sure that you know why you're having these symptoms. So treatment. Hopefully you guys are all sitting at home, shouting out. Obviously, it's going to be sensate focus. Obviously, psychologically, we're always going to go sensate focus in couples therapy, because if we're worried that the person might be having trouble with orgasm because of their own inhibitions or their own guilt or their own, worries about their body image, obviously, we're going to have to work through those issues. Biologically. All right, I'm bringing this up in the female area. It could be true for males also, but it seems to be a more common issue with females that they are not particularly familiar with their own bodies. And so one treatment for orgasmic dysfunction and a lot of other disorders for females is to teach them how to masturbate. And I just wanted to show you guys, this is not, sit in your psychologist's office with your mirror and, get coached. It's you get sent home with a book or a video or something that will give tips, and permission is the biggest thing that is given. This idea that you're authoritative psychologist is telling you that this is in your best interest, oftentimes will allow women to explore their bodies that maybe they had been feeling, those religious or cultural taboos about, or just their own body image issues even impact their own willingness to engage with themselves, right? Those kinds of things. And so guided masturbation is not literally in the room, we're guiding you. Guided masturbation is this, encouragement and sending you home with literature. This is something that also could impact both sexes, but I'm bringing it up with females because Kegel exercises seem to be really super important for females having orgasms. Kegel exercises are those tensing up and relaxing of those muscles that are called the pubococcygeal muscles. Yeah. And so those are the muscles that you use if you want to cut off a stream of urine. So you've all probably had that experience where you've cut off a stream of urine. That's what you would want to tense up. And you want to do them for you want to tense those muscles and hold it for, 5 to 6 seconds, then release, and then hold it again, and then release. And if you've never done it before, practice it while urinating and try and stop that stream of urine. These are important for both sexes to do. This is not just a female tip. Both sexes need to be practicing their Kegel exercises because strong Kegels are associated with more powerful orgasms for both sexes. But for females who have never experienced orgasm, tensing those Kegel muscles, for one thing, makes them more aware of all the muscles that are in that part of their anatomy. And just that right there can make them more aware and more, responsive. But it also can tense up those muscles in a way that builds some blood pressure and can, start the process of arousal during sexual activity. Tensing those muscles while going through, engaging in different activities can actually boost the blood flow, can do a whole bunch of things that make orgasm just more likely. So engaging in Kegel exercises is a great idea. Now, you can, in fact, do them too much. I was reading an article recently that said that women who have urinary incontinence, especially after having had a baby, which that means that, after you've had a baby, sometimes a lot of the muscles are lax, right? And so you sort of have to work them back into fitness. After having a baby, sometimes women will sneeze and then they urinate a little bit, or if they laugh or if they jump, something like that. And so a lot of women will practice their Kegel exercises a lot. And there's some evidence that can actually trigger urinary urgency problems where you feel like you have to urinate even when you don't. So you technically can do it too much. But most people don't do it too much. Most people do it bare minimums. And I would just like to argue practice. Using lubricant is an eye-opener for a lot of women that can really enhance their responsiveness. They can really encourage orgasm. When there's friction, it's not as pleasurable as when it's slippery. It just is what it is, right? And while we've all got this sort of mistaken belief that if you're, really aroused, if you're really into it, there'll just be, plenty of lubrication and you shouldn't need a lubricant. That's not true. There are a lot of reasons why a person would have less lubrication. It has nothing to do with arousal. It could have to do with the climate. Believe it or not, if you're in a dry climate, it's your lubrication dries faster. It's completely water-based, so it dries faster. It could be certain times of the month. Around ovulation, there tends to be more lubrication produced than there is at the other times of the period or the menstrual cycle, and especially in the days following ovulation, there's a significant drop in lubrication. And so adding lubricant can make sex more pleasurable. And so orgasmic dysfunction oftentimes is cured by figuring out how your body responds, really boosting those Kegel muscles and the addition of lubricant. If those things don't work by themselves, there are other things that can work. For some women, they're experiencing a loss of lubrication because they've got low levels of estrogen. It's possible that that's happening because they're breastfeeding. Breastfeeding moms have a hormonal profile that looks a lot like menopausal women. So breastfeeding moms or moms who are women who are past menopause, maybe needing some estrogen replacement. Maybe they need androgen therapy. For some women, they don't reach orgasm because, in fact, they don't have even the little tiny itty bitty amount of testosterone that is required for women to be sexually responsive. And so androgen therapy can help with that. And, it's just a teeny tiny bit of androgens. It's not enough to cause, beard growth or anything like that. And then sometimes antidepressants can help if there are other symptoms that go along with the orgasmic dysfunction that would warrant the addition of antidepressants. All right, how about vaginismus? This is when the woman has painful, involuntary contractions of the lower 1/3 of their vagina. Okay, the key things that I'm saying there, 1/3 of the vagina, that's where all the muscles are in the vagina, that opening of the vagina. So those muscles, the Kegel muscles that I was just talking about, will involuntarily contract like a spasm. And just like you're having a cramp and it causes your foot to point in a weird way and it hurts. That's the exact same thing that the muscles of the vagina are doing. And it's very painful, and it can contract closed so that there's no penetration possible. Even of like the smallest finger, there wouldn't be penetration possible during this painful involuntary contraction. And it might make the woman cry out, like, ow, it hurts, and make the person who they were engaging with, be like, wow, what did I do? What did I do? And it's just this involuntary response. Now, I got this from vaginismus.com, and this is the cycle of pain that they think really goes along with vaginismus. So first off, number one, you're anticipating pain. Now, the most common time that women experience vaginismus is following the birth of a baby, especially if they gave birth vaginally, but it can happen in women who had cesarean sections also. They're anticipating their first return to coitus to be painful. And so they're anticipating pain. They are probably a little scared that they're going to be experiencing pain. That's a really common time for vaginismus to develop. It also can develop in women who may have been, sexually abused when they were younger. And so they have fear and anxiety surrounding sexual activity as a function of things that they experienced when they were younger, or maybe in another situation they had a bad experience. And so they're in that stage one anticipating pain as a function of what they've experienced in the past. So number two is you have that involuntary reaction. The body automatically tightens the vaginal muscles. It's like I've been saying throughout this whole topic. It's not that the partners are saying, that the person is saying, I want to do this. And then their body goes, oh, okay. It's happening all unconsciously. It's happening with the body just responding to stimulation. So they're anticipating that's going to hurt. Their body involuntarily, reacts by tightening the vaginal muscles. And then when they attempt any kind of penetration, it actually is painful. So then in stage 4, the person's like, see, I knew it, right? It reinforces that tensing response because I knew it was going to hurt. So now we enter stage 5. They call it bracing. Anytime that there is a sexual situation, the woman is going to be bracing herself for potential pain again. And in fact, now may move into stage 6, which is the avoidance of intimacy, really trying to avoid having this painful experience again. It may evolve that she says, well, I'm just not really interested in any kind of sexual contact, or I just don't even care if I have a romantic relationship or like that, because the truth is she's gone through bracing and now is just at that avoidance phase. She just doesn't want to experience it again. So what would cause this? I've kind of alluded to some of them, but just some really common things, that we have to always throw in, that the person might be depressed or they might be anxious just in general. It may not have, when we talk about depression or anxiety, we're talking about there's no specific cause for why they're feeling like that. That's what makes it a diagnosable disorder. If there was a specific cause for why they were feeling like that, then it wouldn't be a disorder. It would be called, a reaction to something specific. So we're talking about, in a disorder, depression or anxiety, those relationship problems where, this person has caused me pain in the past, and so now I'm at the point of bracing and avoiding. Like I mentioned, it could be prior sexual abuse. It could be also, cultural or religious taboos where the woman is like, I shouldn't be doing this. Unconsciously, her body reacts to that concern by clenching up. Pregnancy concerns. That's a really common thing for women, especially if they don't have good, reliable birth control, that, they make, their body might inadvertently, unconsciously clench up so that they don't have to deal with the possibility of pregnancy. And then just generally being under stress can trigger vaginismus. Biologically, like I said, childbirth, low estrogen, not having enough lubrication can cause sexual activity, especially coitus, to be painful. And so low estrogen, and I'm refusing to use lubricant, and even though I've got lower levels of lubricant, now sex is painful, so now I'm going to brace, and then I'm just going to avoid it. Infection can cause vaginismus. If you have a urinary tract infection, penetration can be painful. And then the pain is coming from actually the urethra, which is, remember, in the vestibule of the vagina. So a urinary tract infection can make penetration painful. Yeast infections can make penetration painful. Yeast growing in the vagina make the vaginal walls swell and very tender. And so yeast infections can cause pain that then now the person, she's going to clench up and try and avoid the pain in the future. Another kind of infection is called bacterial vaginosis. And this is when the normal biome in the vagina gets out of balance, so that instead of the good bacteria dominating, bacteria that you don't want is dominating. And so again, it makes the vaginal walls tender and can make them prone to bleeding, things like that. Inadequate lubrication, pelvic trauma. If a woman has had any kind of surgery or any kind of infection that she's recovering from, or any kind of endometriosis, or anything that makes her pelvic area tender or, more sensitive, can cause that pain at penetration that then they're going to end up trying to avoid through bracing and then ultimately avoiding. So what can be done? Psychologically, again, familiarization with the body. I didn't use the term guided masturbation because for some women with vaginismus, especially those who have it because of some kind of sexual abuse in the past, suggesting that they try and enjoy sex by themselves might be overwhelming. So instead, it's just, let's just get familiar with your body. You want to own your body. Those kinds of encouragements can help. Sensate focus if the person is in a couple. Couples therapy if maybe that's the source of the problem. Now, biologically, once we've gotten a person comfortable enough with her body that she's able to start thinking about it, guided masturbation so that she can start to enjoy sex by herself, reach orgasm by herself. Kegel exercises so that she can get control over those muscles, so that she knows what they feel like when they're tensing on purpose, and she knows what they feel like when they're relaxing. Whoops, went the wrong way. The addition of lubricant, always a good tip. All right, and then a controversial tip, dilators. This is the kit that you can actually get from vaginismus.com. In the olden days, if a woman was suffering from vaginismus, she could go to a doctor, and he, almost always a male doctor, could insert the vaginal dilators one by one, starting with the narrowest and working its way up to the largest. And the idea is she's supposed to learn to relax through that. And it just sounds to me like the worst idea I've ever heard, having, especially if you don't know exactly why the vaginismus might have started, and she's not saying why it might have started because of sexual abuse. And then here you have this doctor who's supposed to be guiding her through the insertion of these dilators. So what vaginismus.com does is sends a pack of dilators home with, a video and encouragement and a book. And a woman could do it by herself. She could do it with her partner, whatever she feels comfortable with in a situation where she already feels comfortable. There's maybe the possibility that would work. So the use of dilators has really gone out of favor in the doctor's offices. They don't really do that anymore. If a doctor suggests that as a treatment, come to my office and I'll do this. I recommend visiting vaginismus.com and looking at your options, because it does seem a little bit like an additional abuse in a lot of ways. So, but really, the overall treatment, most of these treatments that are on this list really are focusing on the woman gaining control of her own body, feeling comfortable in her own body, owning her own body's responses, things like that. All right, there are some disorders that affect both sexes. So I'm going to take a break here and I will come back in the next segment. We'll talk about those things that affect both sexes.